stand up even when it's hard.
Medicare and Medicaid were created in 1965. Medicare insures 49 million seniors and people with disabilities, while Medicaid covers 69 million low-income and disabled Americans, including 1 in 3 children. But the Medicare fund for seniors is now projected to run out of money in 2024. So how do the presidential candidates weigh in on the subject? Joining us now is medical expert Poonam Alaigh. And let's talk about this right now. Now, why is Medicare one of the top health care issues on this presidential election?
Well, thanks, Mia. Medicare is very important to all of us. It's very personal. All our working years, we've contributed towards the Medicare Trust Fund. And really, the hope is that at the point that you reach retirement or you become Medicare eligible, you do have the benefits around paying for health care, and you don't have to dip into your retirement savings in order to get those services.
But 2024, I mean, that's the projection that it's going to run out of money.
Absolutely, and so there is a sense of urgency, and that's why this is one of the hottest topics when it comes to our healthcare discussions in this presidential election. We all know somebody who has Medicare. We all know how important Medicare is. We know what, the fact that it is a safety net. It is something that we should be getting because we've been contributing to it all our lives. So it is personal. It isn't a benefit that's given to us. We have a piece of Medicare.
And especially with all the baby boomers that will be needing that come to 2024. It's not that far off.
It isn't. And in fact, in the next 20 years, the number of Americans who are 65 and older will double in 20 years. So, those statistics are pretty alarming in terms of what needs to be done and sort of the sense of urgency.
Well, now let's talk about the candidates first. Let's start with the president. How does he weigh in on the subject? I have a couple of different things here that he has unveiled a debt reduction plan in September that's going to cut costs there.
Yeah, absolutely. So first let's talk about why it's so important and the two candidates. So both candidates believe that Medicare is critical. We need to make sure that it remains solvent for generations to come. At the same time, we all realize, including the presidential candidates, that at that stage in your life you need health care, and so you should be getting health care because we've worked hard to be able to get health care when you've retired. And at the same time, there is that assumption that unless you know how much you're spending on Medicare, it's going to be difficult to manage the budget. So both the proposals have that as similarities.
We have similarities. Okay, now let's talk about the differences, because it is often a confusing subject. So let's talk about how they do differ. Let's start with the president.
So with the president, and that's part of the Affordable Care Act, and it's the law of the land right now. So nothing changes for the Medicare beneficiaries. So it is a defined benefit. So whatever the Medicare beneficiary gets today is what's going to stay. If anything, there are some enhancements around getting free preventative care and also being able to get covered for high-cost prescription medications once they hit the donut hole. In addition, what's going to happen in order to pay for that, there's a two-pronged approach.
Okay.
One is there's going to be savings in the Medicare Trust Fund by about $716 billion.
$716 billion.
Over the course of the next 10 years. And the way these savings are going to be realized is by making sure that our systems are more efficient. There's going to be a reduction in payment to some of the healthcare providers, the non-physician providers, and also the health plans that actually render the benefit or have the Medicare health plan. So there's going to be a reduction in payments to these kinds of services.
Now let's turn it over to Mitt Romney, who strongly endorses Mr. Ryan's proposal, of course the vice presidential candidate, about choices. Let's talk about that.
Right. So in the Romney proposal, we're moving from a defined benefit to a defined contribution. So what happens is for those seniors or for those individuals who are 54 and younger, once they hit the age of 65, what they're going to be getting is premium assistance. So they're going to get a certain amount of money to pay towards buying health insurance. And if you want it above and beyond what that health insurance is, you're going to have to pay out of pocket. So there's a concern that at this point, 50% of Medicare beneficiaries are at the federal poverty level of 200% or less. In other words, are making less than $22,000 a year. in the current environment, they're paying at least 22% out of pocket for healthcare costs that are not paid by Medicare.
Does that work in your opinion?
Well, that's the reality right now.
Okay.
Under the Romney plan, the fear is that out-of-pocket cost, because there's going to be a defined premium assistance, that out-of-pocket cost may actually go up to 60 to 70%.
Okay.
So that's a real issue that you know, we're dealing with in terms of what's going to happen to the Medicare program.
I'm going to ask one last quick question for you. Now, we've outlined both candidates' positions on this. What is your position? What do you think needs to be done?
I think we have to have a hybrid model. Again, there are good pieces in terms of what Obama's proposal is. There are good pieces in terms of what Romney's proposal is. We will have to look at what our benefit design is. We have to manage that, and there has to be more accountability built into the system and meeting our sort of expectations when it comes to our Medicare population.
All right, not an easy subject to conquer there. Dr. Alaigh, Dr. Poonam Alaigh, thank you so much for joining us again here on Ebru today.
Thank you.